And I will pass directly to Ota. Ota, you work for eHealth Africa, and you work with developing the international collaboration based on principles for the future. This is something that you would like to bring to this discussion today. I think we can get your slide on, and yeah, please share your view on this topic of Africa Rising with us.
Thank you, Caroline. Thank you, Dr. Francis and Francie. I think I completely agree with what has been shared so far. So I'll just touch on this slide very briefly, because these three ideas that I share here really anchor how I see Africa's role in shaping the next wave of global health innovation. So the first is Africa-led, globally partnered. You see, across the continent, we're seeing ministries of health, we're seeing Africa CDC and coalitions like the Coalition for Women's Health in Africa. We're seeing them set clearer priorities and standards. And we're also seeing partners increasingly choosing to align to those national and regional blueprints instead of designing around them. And that is exactly how we work at eHealth Africa, co-designing with governments, strengthening surveillance, supply chains, and primary healthcare in ways that are fully owned locally. It's not about pushing away partnerships. It's truly about strengthening the African center of gravity. The second idea there is the shift from pilots to shared systems. Pilots have taught us a lot, but the real opportunity now is interoperable systems that countries can actually run and sustain. In our work, integrated digital supply chain and cold chain systems supported more than 174,000 children to be immunized through PHCs this year. And our commitment with UNICEF to solarize 238 primary healthcare facilities is about making sure those digital systems sit on reliable, climate-resilient infrastructure. So when you look at communities, for communities, the innovation is not the technology. The innovation is the reliability, the care, the data, and the vaccines being there every single time, not only when a project is active. And the third idea I have there is backing local conveners for long-term impact. So we see sustained progress happens when African convening organizations, such as the West African International Organization, which Dr. Francis leads. We see the Africa Digital Health Networks. We see the COA, which I mentioned earlier, and many others. They are resourced to keep government, community, and private sector aligned. They keep the architecture of that coherent. So I believe that multi-year flexible support is what allows those organizations, including ours, to hold the data, coordinate stakeholders, and run systems at scale. So the key message for me is simple. Africa already has the leadership and the demand to shape models the rest of the world can learn from. So what will determine the trajectory is how well we align to Africa-defined priorities, how boldly we invest in scalable systems, and how intentionally we resource the conveners who keep these systems working. So very quickly before I cede the floor, I think I want to speak specifically, when we talk about Africa Rising in digital health, I think less about individual apps and more about who is shaping the architecture. For me, the real shift is that African institutions, like some of the ones I mentioned earlier, are increasingly setting the priorities and standards and inviting global partners to plug into that frame rather than parachuting in fragmented systems. That's what I mean, and that's what I meant when I say Africa-led, globally partnered, not just Africa-located. So I would pause now. Hopefully we can take on a lot more when the conversation progresses. Thank you.
It's perfect. Thank you. Thank you so much.
Can the different members of the panel see a time when Africa will be a net contributor to global healthcare? And if so, when? And indeed, how would this happen?
Yes, thank you. Thank you very much, Dr. Francis, for laying that foundation. I think for me, I also just want to add that absolutely, and there are so many ways that Africa has been a net contributor. The shift has actually already begun. We're seeing that Africa is designing solutions under constraints, like from the get-go. We're designing solutions from under constraints, and the rest of the world, can learn from that. So we have climate shocks, we have young populations, which Dr. Francis just spoke about. We have supply chain vulnerabilities, and we have the need for resilient primary care. And we're designing from that, from the scratch, which the rest of the world can learn from. When countries build digital systems on solarized PHCs, for example, when communities co-design data use, and when interoperability is the default, that is the knowledge the world needs. So yes, just like Dr. Francis has said, I also do see a time when Africa is a net contributor to global health. In fact, I think the next wave of global best practice will come from here, from models that are reliable, models that are equitable, models that are climate resilient, and models that are built from the ground up. So our job is simply to document them well, fund the conveners who sustain them, and bring those lessons to the global spaces. Thank you. I just thought to contribute my thoughts.
Thank you so much.